70% of the retention of our learning happens when we have firsthand experiences in those tasks that are helping to sharpen our skills and to advance our competencies. 20% comes from our ability to observe others, and 10% of our learning comes from webinars, workshops, and training. Welcome back to Dr. Sellers Educate. We're happy that you're back to continue on your journey, either towards achieving success on the CNE, becoming a better nurse educator, or perhaps you're on the journey to recertify your nurse educator certification. Here at Dr. Sellers Educate, our mission is simple, and it is to support all nurse educators to achieve certification or to advance their competencies and skills as they continue to enrich the learning environment for our students. In this episode, we're going to continue to look at alignment and what we have developed as a crosswalk between QSEN competencies, the AACN Essentials, the NLN framework, the hallmarks of excellence, as well as the NLN nurse educator competencies. If you're tuning in with us for the very first time, we're happy to meet you. Make sure you go ahead and subscribe to this channel so that every single time a new episode is released, which usually happens every week, you will be notified right away. Now, let me tell you what's different about Dr. Sellers Educate. We are aligned with the expectations that NLN has outlined to help us achieve and maintain our competencies as a nurse educator. Because we align our curriculum with their recommendations, we primarily use Billings and Halstead Teaching and Nursing to reference any of the content that we are sharing in our snapshots. Okay, so just make sure every single time you show up here that you have two resources in front of you. Number one is going to be Billings and Halstead Teaching and Nursing, and right now we're in the 6th edition. In January 2024, we expect that their 7th edition will be released. In fact, we already have our copies. And then the second resource you want to pull out is going to be your study worksheet. Now, what you'll notice about this study worksheet is that it's blank. However, you're going to fill in some really good information to help you stay focused on your journey. Our content, every single program that we develop, is learner-centered. We are focused on the value that you're going to take away with you to help you close your knowledge gaps. Okay, so what we're going to do is go ahead and share our screen. We're going to go through our thought-provoking question, just like we do every single episode. But before we do that, we just wanted to share with you a reference for the 70-20-10 model. Okay, so we're going to be talking about that, but you can find that resource right here in the description of this episode. Now, it's interesting that this model was actually researched by Morgan McCall, Michael Lombardo, and Robert Eichinger in the 1980s, okay, right here in Greensboro, North Carolina, where we're located. They were working with the Center for Creative Leadership. And so what this model really quantifies for us is the fact that we have to approach learning trifold, right? We can't only depend on those webinars, which we know do provide some foundational content, just like this episode that you're watching right now. We want to scaffold, though, or build on those. We want to demonstrate behaviors that we expect our learners to be able to hopefully imitate until they advance their knowledge and skills in a way that it becomes more natural, right? And their behaviors and the practices that they are following. Some components of that is related to effective learning domain, okay? And then second of all, the other part that is important when we think about this model is the value of experiential learning experiences, okay? Because that's that 70% that our learners are going to pull from. All right, now let's take a look at a couple of other resources, and then we'll take a look at our crosswalk. The next resource is going to be the hallmarks of excellence, okay? That link is also listed right here in the description. This is a wonderful model that NLN published to help us really hold ourselves accountable as an academic institution and nursing program to align with these hallmarks of excellence, these specific behaviors that are aligned with excellence when it comes to developing a solid nursing education program where we're able to achieve excellent outcomes, all of our program outcomes, and our students are highly successful. Okay, so that's what this model is all about. The next resource I want to remind you all about and share with you on the screen is the QSEN website. If you have any questions about the content here, there is a contact email right here for you to reach out if you have questions. What we really like about this model is that it is evidence-based. Okay, this crosswalk that has already been developed by QSEN. And what we have done is we have layered on top of their model, which I'll go ahead and share their example here, their crosswalk. We have layered our crosswalk and aligned it with exactly the document that you see here. All right, so what is it that you want to take away when you think about QSEN, AACN Essentials, and the NLN Nurse Educator Competencies? You really want to do two things. First of all, you want to reflect on where your organization is, your education program, as it relates to these QSEN competencies. And then second of all, you want to think about the opportunities, okay, to bridge that gap or to build on any opportunities, shall we say, that you have after you walk away today. So how do you build on those? First is coming together with your colleagues to talk about the discovery that you had today or in our previous episodes. And then you next want to think about what action do you want to take? Are there curricular changes that you need to make based on the content that we have covered? All right, so this is the crosswalk, and you can locate this crosswalk by going directly to the QSEN website that you see here, and then you just want to click on the pre-licensure competency crosswalk, which is the one that we're using, download it here, or you can choose the graduate, okay, whichever one is appropriate for you. And now let's go ahead and take a look at the presentation content that we have for you today. So first, when we think about interprofessional education, we wanted to break it down in a way that provides meaning for you all as it relates to QSEN, AACN Essentials, and the NLN Nurse Educator Competencies. You can see in this video clip that there is a team effort going on, right? They are seemingly moving this patient to a different level of care or maybe to a test, but you can see the teamwork that's going on. I want you to take a moment and just reflect on what you see in this specific video clip. I want you to think about and really reflect on what it looks like in the healthcare setting where perhaps you may have students as a clinical faculty, or it may be where you work. What are some of the role model and behaviors that we can demonstrate for our students to really demonstrate the interprofessional education and interprofessional practices that we expect them to be able to demonstrate? This is the 70-20-10 model that we kicked off our episode exploring. So again, you can see the learning event. That's that structured learning. You can see some examples of what those are. And then that 20%, the observation or learning from others. Look at this momentum, right? This is the foundation. And we know sometimes it's not as sequential as it appears on this slide. And also sometimes there's what I like to call just-in-time training that occurs throughout the entire learning cycle. With this 20% of learning from from others, this is where we want to role model, right? We want to demonstrate these evidence-based practices that we talk about in our episodes. And look at there, you can see YouTube videos are also listed. For those that are visual and auditory learners, this is an excellent way for us to build up momentum in order for us to feel like we're part of the learning experience, right? That it's not a top-down approach, or that it's not one way, that this is a community of learning and comprehension of concepts that happens oftentimes uniquely in this momentum or this 20% phase of learning. And then we have this workplace integration of learning where we have project assignments, shadowing, job rotations, action learning, where we are putting in motion what our competencies are as outlined by NLN and our nurse educator competencies, or in those learning objectives that we have developed for our students, specifically those clinical learning objectives. So let's take a look at our thought-provoking question for this episode. Interprofessional education, also known as IPE, allows team members to learn from each other to provide safe patient care. Which of the following is a critical aspect of patient safety education for nursing students to promote IPE? All right, so we have three options. We are now changing our thought-provoking questions to align with the changes that NLN announced during the NLN Education Summit, where all three exams, starting the beginning of next year, will have three options. All right, so we have A, focusing on individual competencies that can be clarified during IPE activities. B, integrating more discussion forums to introduce concepts of collaboration Or C, emphasizing effective communication, teamwork, and error prevention strategies? All right, so what you want to do is, two things should happen when you get to your question on the C&E exam, or when you're coming here and thinking about the best answer. There will often be, or could be, two good choices, but there's only one best answer. Okay, so what you want to think about every question on that exam: number one, what is it that the question is asking me? Second of all, what is it that I know for sure about the content that's listed in this question? Remember, our effective distractors are going to attract those learners who are not knowledgeable about the content. Okay, so as you think about the purpose of the distractors, you want to be mindful of that as you are developing your 7-week study plan. And if you need to go more than 7 weeks, then we certainly understand that. We encourage you to reach out to us so we can make sure that you're making modifications to your 7-week study plan appropriately. Our objective in these series really is to help you demonstrate alignment with the nurse educator competencies to increase your ability to apply these concepts when they show up on the exam, when you're doing the recertification, or when you're in your classroom developing those solid teaching plans to create a rich learning experience with our students. So that at the level of application and analysis, that's when we are most likely demonstrating these behaviors and really validating the competencies that we are discussing in our snapshot. All right, so before we get to the answer to our thought-provoking question, hopefully nobody saw that little glimpse of the answer, let's go ahead and take a look at our crosswalk. And if you've been following along with us and you have questions about the previous content, we just encourage you to reach out to us. Know that we're here to support your success. We do have a service guarantee, and what that means is we're here to support you until you are successful, no matter how long that takes. Okay, we have a judgment-free zone, is what we like to say. All right, so for this snapshot, we're focusing on teamwork and collaboration, but let's reflect on where we started, and then we'll move forward into looking deeper at our crosswalk. So first, the first episode, we focused on communication and patient safety, and what you see on your screen is we've outlined the NLN nurse educator competency. We've mapped it to the NLN hallmarks of excellence, aligned it with the QSEN domain as listed on the crosswalk that was developed by QSEN and the QSEN KSAs. And then we've also adopted their AACN Essentials domain as listed on the crosswalk as well. Okay, and then the last critical step is going to be, what are those teaching and evaluation strategies that are evidence-based that you're able to look at in the textbook, which is Billings and Halstead, we call that our Bible, to make sure that we are indeed clear about what our teaching practices should be, our teaching and learning practices should be as we interact with our students. And then the resources, we have the QSEN AACN crosswalk, we have Billings and Halstead, as I mentioned, and we also have our NLN C&E blueprints. We want you to go directly to the NLN website. You're going to click certification at the very top, NLN certification, and then you'll click on the left-hand side, the specific C&E pathway that you're going on, and that's where you'll find the handbook as well as the blueprint. So the blueprint, the detailed test blueprint, is included in each of the candidate handbooks, okay? And then, as we looked at earlier, the hallmarks of excellence that is published by NLN is that additional resource for you. Okay, and then episode 2, we looked at clinical knowledge to support patient care. And in this episode, we're focusing on teamwork and collaboration. Now, we've already introduced some of the critical elements associated with how we learn, right? The momentum of learning that happens over time. That was just an underpinning and really some of those core concepts to provide additional context to the content that we're covering today, because we like to keep our snapshot short. The competencies are centered around facilitate learning and learner development and socialization, being able to model the attributes that facilitate learning, and also communication of these interprofessional practices that support collaboration and ultimately provide safer patient care. Next is the change agent and leader, being able to facilitate interprofessional educational and collaborative efforts to impact practice, health, and educational outcomes. And then facilitate learning in the healthcare environment, where we're promoting a culture of safety and quality in healthcare through demonstration of those key interprofessional communication strategies to show, not only to role model those behaviors as clinical faculty, our students in the clinical setting, because we know they're guests when they come into the healthcare setting, but also to hopefully plant some standardized practices with our students' behavior. So when they transition into the clinical setting upon graduation, they're able to maintain these behaviors as standards in the everyday communication they have with their colleagues. Next, we're going to take a look at hallmarks of excellence. There's 2 that we've identified, but there's actually about 5 of them. Okay, so take a look at the hallmarks of excellence. We want you to focus on hallmark number 2-1, building and developing those diverse, well-prepared faculty that really are able to demonstrate the interprofessional collaboration, seen as role models, seen as mentors when it comes to IPE and IPC. And then the other hallmark we want to bring to your attention is 8-1, establishing those effective institutional and professional leadership behaviors where we're able to build a culture of excellence, promoting a healthy work environment, where we have collegial dialogue. We can agree to disagree, but making learner-centered and patient-centered decisions that are going to positively influence the culture and the values that we expect our students to be able to consistently demonstrate. The QSEN domain alignment is with teamwork and collaboration, being able to function effectively within nursing and interprofessional teams, fostering that open communication where we have mutual respect and shared decision-making to make those quality patient care decisions and to achieve the best patient care outcomes. All right, and then we break it down with the KSAs. Knowledge is being able to act with integrity. S, those skills where we're able to follow communication practices that minimize and mitigate those risks. And A, the attitudes that we respect the centrality of the patient family as core members of any healthcare team, that we are communicating in a way that's collaborative and, again, in the best interest of the patient. AACN Essentials that it is aligned with, specifically looking at communication, collaboration, and IPE, is going to be domain 1, the knowledge for the nursing practice, 1.2E, being able to apply theory and research-based knowledge. And then we have domain 2 as well when we think about person-centered care and being able to communicate effectively amongst the team. Domain 6 is where we are engaging in these interprofessional partnerships. 6.1C, being able to communicate in a manner that's going to facilitate equity and collaboration and partnering behaviors that are going to result in the delivery of quality patient care. All right, and then last but not least, as we wrap up, what are some of these evidence-based teaching strategies that we want to focus on? Well, you're going to use Billings and Halstead specifically. Pages 95 and 97 are going to give you really just some foundational reminders about how we move forward in building these effective collaborative teams to make decisions about patient care. And then page 335 and last is going to be page 336 and 3 through 340, and looking at what are some of those effective clinical teaching strategies. And then when you think about those teaching strategies, I want to bring to your attention on page 335. Okay, I'm sure many of these are ones that you're already using, but thinking about those scenarios, okay, where we prepare students in the simulation area or in the skills lab where we're doing role playing, where we have specific scenarios we have built into our simulation experiences where we're involving pharmacy, our allied health partners, as well as other healthcare partners that are included in that delivery of care. Thinking about our case managers, our social workers, right, our nutrition team. So just thinking about all of those really important team members, bringing them to the table and talking to our students about how to effectively work towards the common goal of making sure patients receive care in a timely manner, that their needs are met, and then upon discharge, that they have the support, the resources, and a clear direction about how they are to take care of themselves upon discharge. Okay, so those are just a couple of examples. All right, so as we wrap up, let's go back to our thought-provoking question. So if you chose as the correct answer C, you are correct, emphasizing effective communication, teamwork, and error prevention strategies. Page 309 focuses on IPE. Okay, so that's another resource for you to take a look at if you want a deeper understanding. And also, did you know there were national standards for IPE? They are included in Chapter 11, page 215 from Billings and Halstead. We hope that this episode has been helpful for you. And until next time, you can find us on the website, drsellerseducate.com. Feel free to email us if you have additional questions. And we hope that we will see you in our next episode. Have a great one, everybody. Bye-bye.